Good evening and welcome to the Baltimore County Department of Health webinar series. We continue our series to provide information and education to the public about a variety of public health issues. I am Della Leister, the Deputy Health Officer. This webinar is being recorded, so please follow our social media page and also follow our YouTube page, and you will be able to refer this webinar to others that were not able to join us tonight. I am very happy to introduce our guest speaker for tonight, Dr. Sharon Balcom-Myers. Dr. Myers is a physician with the department, and she's going to talk to us tonight about healthy hearts, risks, signs, healthy eating, etc. So Dr. Balcom, I'll let you take it away.
Thank you so much. So my background is family medicine. I was board certified in family medicine and then went into correctional health and public health for 20 years as the chief medical officer for the Department of Corrections. So I joined the health department, excited about the opportunities to help do some education related to chronic disease. Next slide. So the takeaways. If I had to talk about any priority for this talk tonight, it would be for you to be placed on notice that we have to have a better understanding of what the heart does, how it impacts our health, and what we can do to keep it healthy. I want to know that you understand the partnership that takes place among other organs and diseases that impact the heart. I want you to know that high blood pressure and hypertension is one and the same, and what are positive lifestyle changes that can support a healthy heart, and how nutrition, a dietary approach to stopping hypertension or DASH, may be information that can help save your life. Next slide. So when you look at the statistics related to Maryland chronic disease, kind of reminded in the sense of looking at hypertension, that in the sense of why February as Healthy Heart Month. At the age of 46, President Lyndon Johnson had a heart attack. It was severe enough that it took him out of the minority Senate for 6 months. Subsequently to that heart attack, what Lady Bird and he knew was that he suffered from daily angina. That's your heart letting you know that it's not getting sufficient blood supply. To the point that he didn't have a heart attack and die while he was in office, but the year after he left, he had a massive heart attack and died. During his time as president, in February, he made a proclamation, 1964, to let you know that he wanted to celebrate and notify people that the opportunities to prevent the catastrophic issues related to heart disease was possible. So that proclamation made the month of February traditionally associated with Valentine's and pretty hearts. So to notice that the ones you love, the ones you can save, are affected by what was in 1964 the #1 cause of death. And in 2026, still is the #1 cause of death in our country and worldwide. So it's partners in crime with respect to making the heart not always be at its best is high blood pressure. And when you compare the state of Maryland as it relates to Baltimore County citizens, we have an average of 35 to 40% of our constituents with this disease, which is higher in the overall state. And the same as it looks for diabetes, we seem to match them. We look at obesity, we're a little higher. Next slide, please. Make that a little bigger. Thank you. I want you to pay a little bit more attention we're going to keep playing this over and over because I'm going to talk about that pulsating organ. Usually it just continued to play. We do that. See how it's protected? You see the flexibility of the ribs, the muscles, the intercostals, the separation of the lung. And there it is beating. And there's a sling muscle, the diaphragm, that usually would be between the digestive system and the heart. But its protectiveness, much like the brain that's encased in the cranium, is what's important in the sense of access and helping in the event that the lung has disease, its close proximity to what the circulation issues are with the heart. This is not an organ that keeps itself healthy or the body healthy by itself. So when we talk about heart health, we have to be cognizant of all the chronic diseases that can make its job harder. Next slide.
The heart pumps blood throughout the body, carrying oxygen and nutrients to every cell. It's this circulation of blood that is vital to sustaining life. The heart is an organ made up of several tough layers of muscle. The pericardium is the thin layer that covers the exterior, while the endocardium lines the inside walls. The heart is divided into 4 chambers, 2 upper and 2 lower. The upper chambers, known as the atrium, receive blood coming into the heart. The lower chambers are the ventricles that pump blood out. Between each chamber are valves that open and close and help keep the blood moving. They are the tricuspid, mitral, pulmonary, and aortic valves. A pumping cycle starts when oxygen-depleted blood returns to the heart after circulating throughout the body. The blood enters through the right atrium before flowing to the right ventricle. It's then pumped to the lungs via the pulmonary arteries. There, blood is rejuvenated by air that's breathed in. The oxygen-rich blood returns to the heart through the left atrium, where it goes to the left ventricle. Then, by way of the aorta artery, the fresh blood is pumped throughout the body before the process repeats itself. That process happens with every heartbeat, and it's relentless. The heart beats 100,000 times a day, 40 million times a year, and up to 3 billion times over an average lifespan. But there are conditions that can disrupt a heartbeat and that normality. They can range from myocardial infarction or a heart attack to heart disease and hypertension. In contrast, exercise and emotional excitement can also have an impact on a person's heartbeat. The various blood vessels that comprise the circulatory system are a network of veins, arteries, and capillaries that span over 60,000 miles throughout the body, and the heart is the pump at the center of it.
Next slide. So, as you're sitting there, as I'm sitting here, the thing I know best is I am not aware of my heart beating at all. And at 75, evidently I'm in the billion in terms of beat, but I have not and do not have any awareness of that pump coursing and beating through my body. And that's a good thing because it talks a little bit about the elasticity of those arteries, those veins, and the fact that even though that heart weighs like a half of a pound, the left side is stronger because it has to pump the blood through the entire body, whereas the right side pumps it to the lungs to get the oxygen. It's not a solo artist. It is aware of the pressure in the lung. And if that pressure in the lung increases, the heart has to increase. What can you control? Next slide. The good news is not a whole lot. Sure, if you exercise, you can increase your heart rate. You can actually increase your breath. But there's a difference if your heart's not working well, when you're short of breath. That's different than the fact that when you've kind of exhausted yourself with exercise. And it's a tap on the shoulder for you to think about what's going on with my heart. So a heartbeat under the autonomic nervous system of the brain doesn't wait on us to remember to breathe or to say pump or to say beat. We would die as soon as we go to sleep or nod off. So an autonomic nervous system is super important because whether it's breathing or the digestion of the food that you're going to eat tonight, if we had to direct our systems to do that, we would miss a lot of important opportunities that blood system, as it's coursing through, sure, it's bringing oxygen, red blood cells, to the areas where there are toxic waste. But if you don't make sure the combination of the heart and the lung are healthy, then the heart is going to be the organ that lets you know it's in trouble. Next slide. So we have our own rhythm maker, the pacemaker of the heart. And when you look at the sinoatrial node, there's an area. I mean, there's nothing that just jumps out at you. It's a cluster of muscle fibers. And it's in the upper part of the heart on the right side. And it generates electrical impulses. It has its own electrical system, like a backup generator in case the brain or something tells it starts to have some problems and it can't keep up the electrical rhythms that are in our heart and other places. But it acts as a natural pacemaker regulating the heart. And so when we see on the news football players who collapse after they've gotten hit and they have to do CPR or defibrillate them, about 100 folks a year without CPR and without somebody helping these athletes, they would die. The part of the thing that says we take for granted the natural rhythm of the heart. When it speeds up on our behalf, we're mindful of it. And when it slows down, we're mindful of it. So, but we know somewhere between 70, 75, 80 beats a minute, but there are athletes that are normal at 50. They have efficient pumps and they have wonderful pacemakers. But if you don't maintain your healthy heart, it's the number one cause of morbidity and mortality in our system in 2026. Next. I went into my doctor for an appointment and he says, Dr. B, you know, your blood pressure's been creeping up. And I said, no, the nurse took it. It was 130 over 80. He says, yeah, well, that's stage 1 hypertension these days. So, you know, we grew up and we thought if you had 140 over even 90, that was great. But no, now we're looking at heart rates 120 over 80. I'm 75. I think they should cheat. But if I had dizziness or lightheadedness, if I stood up, we are all unique with respect to our numbers in collaboration with the health of other organs in our system. So diabetic can be a little different than someone who has chronic kidney disease. But what's important is for you to know your numbers. You should know that that top number represents your heart, the beat of the pressure of the blood against the inside of that artery wall. And that artery wall, you know, you want it like WD-40. You want those cells to slide through unencumbered. You don't want to run into plaque, which is a buildup of fatty tissue and calcium. You don't want it to be so narrow that the heart has to get that top number up over 160, right? So when they talk about that top number and how much pressure that blood's exerting against that arterial wall. Believe it or not, we had an opportunity to do something about that. The diastolic pressure, if that heart's at rest, and you know that's just seconds, that's the pressure that it's exerting against the arterial wall when it's resting between contractions. And that measurement is as important in the sense that if at rest, you can't even return to a normal diastolic pressure of less than 80, that tells us a little bit more about the heart muscle itself as well. It is a muscle. And there are things when pressure is high that makes that muscle get bigger, almost to the point where you saw the space in the lower part of the heart, the ventricles. If that muscle gets so big that that space gets smaller and the heart has to work harder, then that heart can go into failure. It cannot keep up with the need of the circulation because its chamber capacity has been compromised. So we want to make sure that when we look at numbers, that you remember it's called the silent killer, primarily because just like we're not mindful of our heart beating while we're sitting here, the majority of people may not be aware that their pressure is higher than 180. They may not get dizzy. They may not have headaches. They may not get numbness. They may not feel weak. They may not have any symptoms at all. And so being able to self-monitor and not have to run to the doctor every time you want to have your blood pressure monitored is a goal to me for most families. It should be. And I think that if you look at the emergencies, 911 calls related to people who do have those symptoms and are heading toward the emergency room, you know, they're not thinking about their heart as much as they're thinking about, am I going to have a stroke? Next slide. So I put this slide in here because I wanted you to understand that there's a gender difference with respect to heart attack symptoms. And I'm not going to tell you that everybody in the emergency room knows that. And in fact, I would say there's more gender bias against women with respect to their presentation and the signs and symptoms that you see under women versus what you see under men. So what we do know is that, yes, they may both have nausea and vomiting. And the reason they may have that is that the body, in the sense of blood flow to the stomach and the intestines, isn't being done by the heart. And their tap on the shoulder to you as a patient is nausea and vomiting. But if you think about all the things, flu, you know, ate the wrong food that could cause nausea, vomiting, we could certainly understand why somebody might be sent home with Pepto-Bismol or Tums. But let's suppose, in addition to that nausea and vomiting, you notice that there's a pain on the side of your neck. It's not a like aching in your face pain. It's dull, but you haven't had that neck or jaw pain before. When you couple those symptoms together, those are big ding, ding, ding red flags that you may be having a heart attack. People do have silent heart attacks. And in fact, there are some folks who didn't find out that they have had a heart attack till they had a resting EKG and it showed damage and they didn't know it. So they share jaw, neck, back pain, nausea, and vomiting. Women are less likely to have squeezing chest pain or pressure like an elephant sitting on your chest. But they do share shortness of breath. But it's an air hunger that people have described differently than they do when they're short of breath after running. And I think it's kind of like labor till you experience it. Maybe we don't know what that symptom actually feels like. But if somebody says, And especially with when the inferior part of the heart is damaged, people are more likely to come in with signs and symptoms of indigestion. It's not easy to diagnose a heart attack. I mean, we do blood studies, troponin, keep you there 6 hours, and give you some oxygen, and then start looking for things. But imagine if you'd just come in and they said you fainted. Would the workup start? It's cardiac. Probably not. So I think women and gender bias, it's even a more noticeable when women come into their primary care doctor and complain of extreme fatigue. Who doesn't have fatigue in our lifestyles these days? But is this a different type? Because you know that this woman, even if she has 5 kids, that fatigue feels different. We're not going to just dismiss it as perimenopausal or menopausal. You're going to have to ask more questions. But most importantly, you're going to have to be an advocate for yourself. And your knowledge of what those symptoms could be in combination, and your persistence in understanding that there are some tests that we can do, which depends upon whether you leave that office or go over to the hospital. It's important for you to be brave enough to ask those questions. And I think we're having to make more doctors pay attention, whether it's a PA or a nurse practitioner or a physician. It's important that you find one that is willing to listen and communicate with you. Next slide. I told you that just in a solo manner, take a look at heart healthy and not think about hypertension or diabetes would be inappropriate. I want you to know that the second cause behind diabetes of blindness is uncontrolled hypertension. I want you to know that just as high blood pressure can be a silent killer, after diabetes, hypertension is the second cause of chronic kidney failure. And there'll be people who say, how did I lose my kidney function? And the doctor's going to let them know, how long have you gone without having your blood pressure treated? And half of them are going to say, I didn't know it was high, right? So what does Stroke Smart do? We had a governor previous to this one who made Maryland a Stroke Smart state. And this government continued that. And then the Baltimore County Health Department made Baltimore a Stroke Smart county. And it's simply making you aware of what the signs of a stroke are and when to call 911 for even one sign. And even if that symptom stops. So if you ask someone to smile and it looks crooked like the one on the right, believe it or not, there are people who will wait, sit down in a chair, especially your grandparent or your aunt, because they're already thinking about the cost of the ambulance to the hospital. Are they embarrassed? Are they afraid? So it's very important for kids who are able to speak, to know in that family, especially when we have seniors with the daycare situation who may be hosting their grandchildren, and that grandchild may need to be educated on signs and symptoms of stroke. Next slide. So before, the acronym was just FAST, and B was added, B and E, because as you can see, there were people having coordination issues, but didn't think about, am I having a stroke? So they thought more about inner ear infection, right? Or maybe a side effect of the 15 tablets they're on. When you can have blurry vision, and it goes away. And then it comes back again. We find that people don't think that perhaps there could be a clot that may be not stable, passing, coming back. They're not going to think about that. In fact, they may think more about their diabetes than a stroke. But I think for the most important part of BFAST was the T. We found sometimes people waited for days. And so that window of opportunity where they could give you a medication that would remove that clot is gone. That's usually within 4 hours of symptoms. So, if nothing else, an understanding. Here again, if you have atrial fibrillation, you have almost a 10 times greater opportunity to have a stroke. Again, the heart is not a solo organ. It is mindful of the sense that the organs, along with those blood vessels, are part of their team. And if there are clots and narrowing that break off and go to the brain, they are going to be aware of that signal. If you've already got an arrhythmia, you don't have the luxury of waiting around because you already have a super high opportunity for that to be a stroke. Time to call 911 and to educate your family members, kiddies too, what it is BFAST stands for. Next slide. The reason Healthy Heart has to have a shared discussion with respect to hypertension and diabetes and the other lifestyle opportunities we're going to talk about later. You cannot think about hypertension without thinking about unhealthy lipids and cholesterol. I've said that we know that diabetes already is the number one cause of blindness and kidney failure, but right behind it is hypertension. But in the middle of all this is the fact that we have other lifestyles that aggravate the opportunity for healing if you're doing things that you think are going to bring your blood sugar down or your weight down, etc. And that number one cause to me in terms of factors is smoking. You know, nicotine is almost like an adrenaline trigger for most people episodically, but that adrenaline is an unhealthy impact on your heart. It's going to temporarily make it beat a little faster. Smoking also is a huge inflammatory agent. Inflammation not only increases clot formation in those small blood vessels, but if you think about it, the kidney failure is because, you know, those blood vessels are bursting because the pressure's higher. And if you look at that small blood vessel in the white of your eye and it's red, then you know the heart's done its job to something that's so small microscopically. Some people have to look at it, but smoking causes vasoconstriction, which means that it actually triggers the blood vessels to get narrow. So the internal environment of that blood vessel that was once elastic and not stiff becomes a spasmic vessel that, in the sense of blood flow, is an impediment. So if you look at an unhealthy diet, what are you thinking about? What is it about processed foods that aren't good for us? And how do we differentiate that from whole foods? So everyone who talks about hypertension wants to talk about sodium. And so when you look at it, you can't talk about sodium without talking about the kidney. The kidney works with the heart as relates to hypertension by what? Being that sodium pump, changing that potassium, and helping you pee that out. But if you look at how the hormones that the kidney uses to help monitor and control blood pressure. They don't help the heart in terms of blood pressure, which is why a lot of the antihypertensive medications are ACE inhibitors, angiotensin inhibitors, which are hormones for the kidney. So nicotine competes with insulin. Insulin, as you know, is a hormone made by the pancreas so that you can lower blood sugar. But insulin spikes are also associated with blood vessel mobility issues. They're also associated with laying down, uh, what I used to call it lousy, lousy cholesterol. So LDH, lousy, low density cholesterol versus heavenly, which is the high density. So the L is low and the H is high. And the high cholesterol is a protective one. So you want that number to be up and you want the other one to be low. But if it competes with insulin, then you know why smokers may end up higher risk for type 2 diabetes. So when you look at those conditions and you look at your diet, you can go on YouTube and it's confusing. What do you eat? Right? They don't want you to eat processed foods. They don't want you to eat pastries. They don't want you to eat salt. So is it all going to be spinach and broccoli and kale? One of the things that people really don't know is, what can I eat now? Because it's not just me and this family. I've got to be mindful of everyone. And then I have to take into some consideration, the non-medical issues that impact my opportunity for a healthy diet. How much money do I have? Am I in a food desert with respect to opportunities for fresh produce? How far do I have to travel to get that healthy diet? And then if you look and say, where do I live? A lack of exercise may be just safety. There are no lights where I want to walk. There's nothing that can protect me. There are no sidewalks. I'd have to walk in the street. And for obesity, your BMI, if I'm not active and I'm not eating foods that are healthy for me and I'm smoking, then I look at the opportunities to say, okay, I'm watching TV because I'm not outside walking. My kids are playing video games. I can't even get them outside. And so, what are going to be the opportunities for me to look at ways to pump blood from my lower extremities, because that's what those calf muscles are for. So, if I'm not moving those muscles, then I'm increasing my opportunity and risk for stagnation in those vessels and for blood clots. So we have chair exercises. There are some things that, is it Eugene? He does exercises, stretching. I don't know about Tai Chi, but those conditions, diabetes, high cholesterol, atrial fibrillation, 87% of all of the challenges related to health and heart can be preventable. Next slide. I don't know if anybody else knows who this legend is, but he's Arthur Ashe. He's a tennis legend, iconic activist, and he's someone, if you look at him, his health, his muscles, his body, he didn't smoke, he didn't overeat, he exercised on the tennis court. But one day in a tennis clinic where he's teaching kids the rudiments of tennis, he just kind of rubbed his chest and said, if I didn't know better, I think I'm having a heart attack. And there was a cardiologist whose son was in the clinic. He said, look, my office is right across the street. Let's just go check you out. He was having a heart attack. Why was he in disbelief? Next slide. Both his parents had heart issues at an early age. His mother had hypertension of pregnancy and died during that pregnancy. He was 6 years old at the time. His brother, who was a product of that pregnancy, had cardiovascular disease. So, what he couldn't control was the genetic factors of both his parents, his grandparents. And at 36, he suffered a heart attack while conducting that clinic. Now, he had a quadruple bypass, but in 1983 in California, they weren't screening blood for HIV. And at that time, he underwent a second, more complex bypass surgery and got the AIDS virus, and that's what killed him. Next slide. So when you look at the four unmodifiable risk factors, and I gave the example of family history, but he was a Black male, that's gender and ethnicity. And his age to me at that time still was a little young, 36. But when you look at what's uncontrollable versus controllable, and you go through this list, one thing that he did have as an African American man and pioneering in looking at tennis as a sport, he said he suffered more stress as an African American man playing tennis in a traditional white sport than he ever did in anything else in his life. That's a sad fact. I put that in for Black History Month, but I wanted you to understand that we should not underestimate that. He didn't have a poor diet. He didn't have a lack of exercise. He wasn't obese. He didn't think he had high blood pressure, but he didn't know. I thought sports guys had physicals for that. He certainly didn't smoke. He didn't have diabetes, but he had stress, gender, ethnicity, and family history. And that's what brought him into a heart attack range and subsequently HIV. Next slide. So, if the takeaway about how to keep your heart healthy makes you just think about your heart, then I haven't done my job. Because your heart is reactive to everything that's part of your health. So if you're a diabetic, if you're obese, if you have lung disease and your lungs are obstructed, your heart has to work harder. So when you smoke, you get emphysema, you're not helping to keep your heart healthy. When you look at weight management and the stigma in this country with respect to overweight people, and you see the GLP-1 epidemic, and then knowing that maybe a lot of weight management isn't something that's in our control, and it shouldn't cost us $300 to $500 a month to use the hormones that we've now discovered that can make a difference. So if we treated everybody with respect to those who could take the GLP-1s and lowered tremendously obesity, and they were able to exercise and they kept their blood pressure, means we'd be doing great. The biggest issue that we don't want to address most of the time, but we're going to have to, is how many of the diseases that we are managing are being aggravated by inflammation. And sugar is one of the biggest inflammatory agents we put in our body. And it's not always just pouring, a half a cup in your coffee. A medium banana is 12 teaspoons of sugar. There are hidden sugars everywhere. And then you look at the labels and there's additional sugar. Then you're going to have to make changes in helping not just your diabetes with the change in that, not just your smoking with the type 2 diabetes, not just your weight, but the whole part of the heart, lung, organ system in keeping your heart healthy has to be mindful of more than just the heart. And so, whether, next slide. So, we want to help. We want to have everybody learn prevention. And our program focuses on, like, the number one killer of people, cardiovascular disease, diabetes in terms of morbidity and mortality, and renal failure and heart attack, obesity and hypertension because of its partner with stroke. So if we can link to services that we have as a department, our doorway is an entryway to all of the programs that the Baltimore County Health Department has to help you with the education related to chronic disease, and including a walking program that Wednesdays and Fridays that you can still join. But we have nurses, nutritionists, outreach workers. We have a lot of people with a lot of knowledge. And this is the slide that lets you know that we can be that educator for you, your organization. Next slide. So a dietary approach to stopping hypertension, or DASH, is part of that Healthy Heart Ambassador program. So when somebody has hypertension and they need support in terms of blood pressure management, self-management, blood pressure cuff, they have a program that's scheduled weekly and bi-weekly with a number of resources. You can call in, you can visit. Next. And it's free. So when I talked about lowering sodium intake, sure, it's still one of the primary preventive measures that you can take, but it's not the only one. And if you don't modify your diet, I can tell you, you can take all the diuretics you want, but if you overrule them with excessive salt, they're not going to be effective. Some of your medications would be more effective if you would follow some of the dietary steps that are related to the DASH diet. And so if you recognize the food forms that sabotage your goals, and you got to have a holiday, they understand that. We're all human beings, but you should be on alert and you should be mindful as it relates to the food that we take in, the fast foods that we feed our children, and the sugary cereals that make them run all over the place when you're trying to work from home. Next slide. So the eligibility is on this slide. And, at one point in time, we thought that people who were going to do prevention should know their family history, see that they're kind of like at 130, some opportunities for intervention. But they've changed the program, and you can come in if you've been diagnosed with high blood pressure, or you're not sure, let us help you with that too. But I think it's important for you to understand that this is basic education, and we are mindful of the population we serve and the challenges with respect to their social determinants of health, and we help to work around those challenges. Next slide. Locations, more to come, ambitious. Next slide. So the contact information as relates to any questions that you have about this program or the health department in general, that's the information which can be requested and distributed. Next slide. And that's where we are. Any questions?
I asked would like to, you can unmute yourself and ask the question verbally. I want to remind you that this was recorded, so it will be placed on our social media page, so you can refer to it again, and you can also refer your friends to it. There's comments. They were very happy that you put Arthur Ashe and tennis in your presentation, Dr. Balkamars, so that was great. The information about our Healthy Heart Ambassador program is on our social media page. We encourage anyone that has concerns and would like to be involved in prevention or healthier lifestyle to please contact that program. We have programs in multiple locations, and we're always looking for additional partners and locations to train and start up new programs. Dr. Balcom, I want to thank you very much. We enjoyed your presentation. The videos were fantastic. And I see lots of thank yous in the chat. Our next webinar will be Wednesday, March 25th. Our topic is still to be determined, but keep an eye on our social media page. Sign up for our Constant Contact newsletter. If you have any other questions, please contact the health department. Thank you all very much.
Thank you so much.